I'm back with another update. I had some appointments today. I met with my genetic counselor and with my surgical oncologist. But first off, before we get into cancer talk, I am super excited because today was my 1-year anniversary doing French. So that was my last year's New Year's resolution. So I was pretty proud of myself for sticking with it and doing it every single day for an entire year. I've come very far, so that's something pretty exciting. I've never actually completed a New Year's resolution before, something that I actually chose, stuck with, and finished. So, and I'm still doing it. So pretty excited about that. But an update on what's going on. So I had a meeting this morning with my genetic counselor, and I realized that I had an extra kit that I got when I was doing my genetic testing, because one of them we thought was lost or delayed, so she sent me another one. So I thought it would be cool to show it with you guys and kind of show you how I collected that, because it's kind of like one of those family tree things, those genetic testing that you can figure your heritage. So you get this kit in the mail. It usually just comes via, I think it was FedEx or in the mail, so they'll stick one of these in the mail to you, and it comes in a box like this. And in the box there will be a kit, and then it comes with instructions, and then it comes with the order. So on the order you'll it's usually, well, they filled it out for me, like they chose the test, and I think they put the doctor's name. So there's just a few other things that you need to fill out on there, but not much, the date of collection and things like that. But also on here it tells you that they're testing, for me at least, they did the BRCA1 and BRCA2, and then they also did the breast stat and comprehensive. So it tested for 81 different genes, and it tested a whole bunch of things, not just breast cancer, but I think it's like women's health. But when you get it, there's going to be a bio bag in there, and in the bio bag is going to be a step-by-step instruction. So basically in here is, let me open it, it's a little container, and there's a line right here on the top that you have to fill up with spit. Sorry, that's gross, but so you basically, you can't eat or drink anything for about, I think it was 20 or 30 minutes before you do the test. So once you kind of fast for those 20 to 30 minutes, you just put it up to your mouth and you just keep spitting in it until you get to the fill line. And it can't be bubbles at the fill line, it's got to be the saliva, but we'll move on from that. Once you are finished, you just kind of put this cap on and you snap it closed, and there's a liquid in here, and it's probably a preservative or an enzyme to help, you know, keep the saliva preserved, or some sort of thing that, you know, maybe marks certain things on there for the testing. But once you do that, you just kind of shake it up and mix the preservative with the saliva, and then you'll put your name, date of birth, and the date of collection on here. And then once you do that, you're gonna take the put it back into this container here, and then you put it into, it'll fit in there, but then you'll put it into this here, into the bio bag, and then there's a little wipe in there so that if it does leak, it absorbs it. And then there's a QR code that you'll put on the top of this paper, because this QR code and number is attached to your name, so that when they scan it, it all matches up. So you'll put that on there, and then you just kind of fold everything back up, put it back into this box here, and then they give you a prepaid envelope. So you'll just take this, and I dropped mine off at a FedEx. So you just drop it off and they'll mail it. I think you can even do an at-home pickup thing, but it was pretty easy. So I got my results back last week, but I didn't meet with the genetic counselor until today. So it was pretty cool because we talked a little bit about my family medical history and genealogy, which I'm a science nerd because I used to be in the medical field for a while. So it was kind of nice to do that stuff again. So we went over that my mom had breast cancer when she was 35, or well, she passed away when she was 35, but I was so young that I don't remember what kind she had, or if she went into remission and it, you know, or how long she had it. I don't remember. I do remember her going through chemo. I do remember her doing radiation. I do remember her having a mastectomy. I do remember it metastasizing. Unfortunately, it metastasized to her brain, and she was paralyzed from the waist down, and she went blind before she passed. So we talked about that, and then my sister had informed me, I think it was about a week or so ago, that my first cousin ended up testing positive for what I tested positive for, which was the ATM gene. So my sister had the BRCA1 and 2 done, and she was negative just like I was. So don't think that just because you're negative for those two not to take your mammograms and stuff seriously, because I didn't. I thought I was good. If my BRCA1 and 2 was negative, I was good. So I got too comfortable with that. So just because you're negative for those, get tested for more or stay on top of your mammograms. So we talked about that history, and so with my first cousin and myself testing positive for the ATM gene variant, then she said she could definitively say that my mom was a carrier and passed it to me, and more than likely my mom's niece, which would be my first cousin's mom, is a carrier. So she highly suggested that my sister get tested, and then my cousin's sisters get tested to make sure that they're not positive, or if they are, then they can stay on top of the things like mammograms and stuff. So I was positive for the ATM gene variant, and that gene variant can have a risk of breast cancer, ovarian cancer, pancreatic cancer, and colon cancer. So with breast cancer, if you test positive for the gene, it increases your chances of getting cancer by about 20 to 40%. If you test positive for that gene, it increases your chances of ovarian cancer by about 2 to 3%. With pancreatic cancer, about 5 to 10%. And then with colon cancer, it didn't say a percentage, it just said an increased chance. So with me having pancreatitis, she wanted to make sure that we stay on top of that. So she's referred me to another GI doctor to get an upper GI done, take a look at my pancreas so we can kind of get a baseline, and I might have to do some more genetic testing to make sure that I'm not positive for any pancreatic cancer genes. They can't add a pancreatic panel to this, so we have to do a separate genetic testing for that. So she said she wouldn't be shocked if I had a hereditary thing for pancreatitis. So we went through that. And then when it comes to my kids, because if you are a carrier, which I am, and fortunately both of my kids are fine right now, so it's not likely that their father is a carrier. It's not likely that he is. So she said that when they are 18 or older, they can get tested for free, because when you do the genetic testing and if you test positive, your kids can get tested for free, but they have to be at least 18. She also said that unless they were getting tested for reproduction purposes, which my kids are 14 and 19, they better not be having no kids right now. So, and unless they're getting tested for that reason, she said they won't even start any preventative treatment until like their mid-20s or early 30s. So she said it wasn't really worth getting tested right now unless they just wanted to know. But if they were married or wanting to start a family, that they should get tested along with their partner, because if, let's say, my oldest has the gene and let's say his wife has the gene, then it can cause an extremely rare anomaly, which is not good for kids. I'm not even going to try to pronounce the name of that anomaly, but it's not good. So it can have some potential risks for their future children. And I don't want my grandchildren being hurt by this. So I think they should get tested. So I met with her today. And then I also met with my surgical oncologist, part of a pre-op discussion, because it is Monday and my surgery is on Thursday, so it's 3 days away. And the closer it gets, the more nervous I get. It's one of those things where you're excited because you want to get it out. You're anxious, you're looking forward to it. You're like, let's just go. Let's go now. Let's get it done. I want it out of me. I want to be done with it. But it's been taking an emotional toll on me the past few days. Getting nervous about it, wondering if they take it out, are they going to find anything else? Are my lymph nodes going to be positive? Because I just have this thing in the back of my head about it metastasizing, because it did with my mom, and I'm just really nervous that they're going to find something else. But I'm just also not looking forward to the treatment afterwards, but hopefully I won't have to have chemo. But she said it'll depend on the pathology reports from the breast tissue and from the lymph nodes that'll determine if I have to have chemo and radiation. Since we're doing a mastectomy, we might not have to do radiation, but we'll see. But we will definitely be doing hormone therapy, so I'm kind of nervous about the tamoxifen and the aromatase inhibitors. I can't pronounce that first word for some reason, but there's just a lot of unpleasant side effects, and I've been watching a lot of videos on it, and they say like joint pain, weight gain, hot flashes, mood swings, depression. And I've watched some videos where it says that a lot of women just stop their hormone therapy because those symptoms can get so bad, and so they just stop it. So I'm kind of nervous about that. But I have my post-op or pre-op evaluation tomorrow, and they're supposed to be doing some more scans. I'm not sure if it's just mammogram, MRI, CT, I don't know, but they want some current scans. So before surgery, and then blood work, then they're gonna check my medication list and tell me what I can and can't take the day of surgery. And then they're gonna give me some things. I guess I have to get some antibiotic wipes from them and antibiotic soap, antibacterial soap. The night before and the morning of the surgery, I have to do antibiotic bath, like from the neck to my waist, and then the morning of. So on Thursday, I have to be at the hospital at 11, and then my surgery's at 1:30. She said that it'll probably be about, her part, the surgical oncologist part, will be about 2.5 hours, and then the plastic surgeon part, she said, will probably be about an hour and a half, maybe 2. So she said that they'll make an incision like right underneath the breast, which is right along the bra wire, like the wire, and she'll pull out all the breast tissue, and then she will leave, she said, some fat and skin there for the plastic surgeon who will come in and do the implant reconstruction. And then she said she'll also be taking some lymph nodes from underneath my arm. she said that I won't be able to feel my breast anymore. She said all of that breast tissue is going to be numb for the rest of my life. She said possibly underneath my arm here might be numb for the rest of my life, but she said some people have said that that does get better over time, so small price to pay. So I'm kind of nervous about all that, but she said they're also going to put in up underneath the pectoral muscle, they're going to do like almost like an epidural, like when you have kids. It's called a pectoral block, so that should help with the post-op pain. So we'll see, but I'm excited and nervous, but I just kind of want this to be an educational thing, because I've been watching a lot of videos online about, you know, vlogging and stuff from people who have actually gone through this and had invasive ductal carcinoma, and what they did to prepare for surgery, and their tips and tricks for after surgery and hormone therapy and chemo and stuff. So I'm gonna try my best during post-op to show you guys like the drain and what I do and how it's going. They may not always be very long videos, but I do want this to be an educational thing. So I know it's been very helpful for me. So I'm hoping that what little bit I can share, even if it just helps one person, it only takes one. All I need to do is help one. But if anybody has done tamoxifen or the aromatase inhibitors, I don't know why I can't pronounce that word, but if anybody else has done that or is, you know, going through that therapy right now, any comments or, you know, something would be great, which is also a good time for me to just say, please like, subscribe, and select all so that you can receive automatic updates when I post my next videos or shorts. But I appreciate all the subscribers that are subscribed right now, and everybody who has liked and watched my videos. It means a lot to know that these videos are being reached and people are watching them, and I'm just hoping they're helping people. So I will post a video tomorrow after my surgical evaluation, just to let you guys know how that goes and what happens during that. And yeah, so countdown, 3 days till surgery, and until then and after that, all I gotta do is fight on.